I welcome you to HealthPort. This is a new year, 2023. We want to thank God that we are back, and this time we are big and better. Now, one thing you should not forget is that HealthPort is a program that is centered around maternal and child health, early childhood development, and other public health concerns. And this program is brought to you by Makerere University School of Public Health, together with Church of Uganda Family TV. And it is the reason we are here. With me, Adrian Austin Mukalazi. And today we are joined in with amazing people. Now, these are students who have done a lot to see that our communities become a pleasant place for us to stay. And these people are here to share with us what some of the things they do when they come out there in our communities. I know you might have seen them, you might have been part of their programs, and here they are with us. They're going to tell us why they choose to do all this. Why, how do they even benefit? Because in Uganda we have one disease. Each time we see someone doing something good, we think they're up to something. No, they also tell us what they're up to. So, with me is the one Shafik, Shafik Senkubuge. Shafik Senkubuge is the president of Makerere University Environmental Health Students Association. And we also have the one Doreen, Nabaiggwa. She's also a member of Makerere University Environmental Health Students Association. So they are students of environmental health. Now, have you ever heard about environmental health? Do you know how important environmental health is to you, your family, and the country at large? They're here with us to answer all those questions. Shafik, His Excellency the President, yes. You're most welcome to Family TV and HealthPort.
Wow, thank you very much, Mr. Adrian Mukalazi. Actually, on behalf of Makerere University Environmental Health Students Association, we are very delighted to be here. We thank our sincere regards and thanks to the School of Public Health and Family TV for such a wonderful program. And as Makerere University School of Public Health really embraced such platforms, and we are really grateful. My name is Senkubuge Shafik. I don't know what's yours, but I'm really very grateful to be here. So just expect to learn more from us. I'll be giving you more details about Makerere University Environmental Health Students Association, what we do. As Hadi alone highlighted, we really do a lot of things within the environment. I believe some of you have ever seen us within your communities. Ask those of Nansana, ask those of Kagugube, ask those people who are living around Mulago. Really, they will tell you what Moes has done, and very many other communities. And over to you, Doreen. Maybe you can give some advice.
I think we skipped protocol. You know, in Uganda, we embrace ladies first slogan. And this time around, I started with a gentleman. But Doreen, just take it with a good heart. Kindly greet our viewers, and then we proceed.
Okay, I receive it with a good heart.
Okay, good.
Thank you very much, His Excellency Senkubuge Shafik, for that brief introduction. And thank you very much, Adrian, for inviting us here and having us here tonight. I'm by the names Doreen Nabaiggwa Doreen. I am a student at Makerere University, a proud member of the Makerere University Environmental Health Students Association.
I have seen someone trying to imitate, someone behind the camera trying to imitate the word Phoebe. So you talked about, you said you are a powered member of Makerere University Environmental Health Students Association. We will start with you. We are looking at a layman's perspective of the word environmental health. How can you define, how can you broaden it into someone's mind to understand what environmental health is?
Okay, thank you very much for that question. First and foremost, I feel so bad when someone asks me, what are you doing at Makerere University? And I tell them I'm pursuing a bachelor's degree in environmental health science. And they ask me, what is that? And you want to explain that, you know what? Under medicine, we have two branches, the curative and the preventive. And then they'll still ask you, what do you mean by that? And exactly, you want to tell them I'm under the preventive arm of medicine. And then some people will ask you, so are you doctors? What are you doing with that? And sadly, here in Uganda, what we call those preventive doctors or people on the side of prevention, we call them abasawo b'obulamu. Now when you talk about omusawo w'obulamu in Uganda, people are going to tell you, oh, wanena batugamba mugende muzimbe toys. But we are not only that. We are beyond telling people to build toilets. We go to the extent of finding out why are diseases like COVID coming up? What is the cause? How are these diseases being transmitted? How do we prevent them? We come up with interventions for prevention and control. So this is what environmental health science is all about. It's a discipline that tries to show the interaction between humans, the natural environment and the built environment, and how we interact and how these environments affect us, affect our health. So basically, that's what I will say environmental health science is all about. We study the environment and as humans and how these interactions with the environment can affect our health. So how do we prevent ourselves from getting diseases from the environment, but coexisting? Because we can't live away with the environment. We have to coexist with the environment, but we don't have to affect it, and it doesn't have to affect us. So
there is someone who said that the number one enemy of environment is man.
yes.
Do you agree with that, as you, the environmental health scientists, that man is the number one enemy to the environment?
Yes, actually, when you look at the current trends, when you look at the challenges we are currently facing, the likes of global warming, climate change, the likes of air pollution, all these actually are attributed to man and his activities. Man has done a lot in trying to expand his premises. For real, this has led to vandalization and extinction of a lot of biodiversity. And this biodiversity has been really very instrumental in promoting the health of us as humans and the entire world at large. So really, man, including me, we have been really very instrumental towards degrading the environment. Maybe Doreen, you can chip in about that.
You asked that question, but for me, I would say to one extent, it is. Man is not actually an enemy to the environment. We are just trying to live in the environment, but to see how we survive, because a man got to see that you can't walk from, let me say, Mbale, you want to go to Gulu, you would need a car to transport you. But the problem is some of the inventions we are coming up with, they are in return affecting the environment we are living in. It's not that we are enemies to the environment. We love the environment because that is where we survive. But some of the things we are doing, they end up indirectly or directly affecting the environment. So this is why we need to find ways of coexisting with the environment in ways that we do not affect it. Because we need to understand that this issue of sustainability, you're living here today, but the people are going to live in the world later on after you. So how do you ensure that you do not destroy the world for the people that will come in later on?
Okay. And now, because this person who said that said, when you look into your mirror, if you're looking for the enemy, the number one enemy of the mirror, you just go and stand before your mirror. The person you see there is the enemy. But out of this discussion, as someone out there will know which activities they can do to conserve the environment and which activities they are doing that are harmful to the environment. And I'm really grateful that you've stood out to come and share this with us and with our audience out there. So, Shafik, if we can say, why do you think we need environmental health scientists? Because I remember when we were in primary, we used to study, I think it was it? I'm forgetting that, but it was under science, where we learned some of these things, the importance of a rack, the importance of a toilet, the importance of washing hands.
Yes.
Do we really need environmental health scientists, even with this primary information that we get in school?
Wow, thank you very much, Mr. Mukalas. I'll start by responding to your question by saying, really, really need environmental health scientists and in very large numbers all over the country and all over the globe. This is one reason why. When you look at the current trends of all diseases that are affecting humans, they are all preventable. They are attributed to these diseases are attributed to infectious diseases, that infectious agents that really can be prevented from us. So when we have environmental health scientists, these are individuals that are looking at mitigating these diseases from reaching to us. They try to modify the environment in such ways that really prevents us from getting contact with these infectious agents. I'll give you examples with our daily life, the likes. These people try to come up with innovation to promote food safety, to promote proper solid waste management. I'll give an example of KCCA. You see these guys trying to collect garbage on a daily basis. You look at our communities, the likes of, do you know that even people of police are promoting environmental health through putting up measures like the currently advocating for use of reflector jackets and elements. That's environmental health. We are trying to protect people from getting injuries on through use of roads. We are seeing interventions on drowning, people being told to wear life jackets. Really, environmental health is everywhere, and it really concerns us. It's a pertinent issue, and we really have to take it up as individuals and communities. A number of stakeholders, the Ministry of Health, have really advocated for this, and they have known that if we advocate for prevention better, and we leave out curative usually, it's really good to advocate for prevention as regards to cure. Really, you can prevent yourself from a number of diseases by using simply interventions. Take an example of malaria. Malaria can be intervened by sleeping under mosquito nets, creating a barrier towards getting these infectious agents. You look at diseases like cholera, you know it's really transmitted through contaminated food substances. You will have to really get rid of this food, promote food safety and hygiene, both at home, through the food chain system, through the processing industries, at consumption level and delivery. Those interventions really promote our life, and we are able to live in a safe place as Ugandans. As I said earlier, we are learning more. Mukalas, I hand over to you.
So you've partly answered my question, because when the traffic had just issued the directive that every border rider should have a reflector jacket and a helmet on their heads, people were asking, but why do I even need a reflector jacket? And partly you've asked that. So we need people who come out to say, you need this because of this. Wow. Doreen, any submissions?
Yeah, thank you.
Especially because this is an era where we agitate for emancipation, where we want women to do equally, to take up roles that were maybe earlier for men. Now, as a woman who is standing in to come out as an activist of environmental health, I would call you an activist because I see you speak with a lot of passion.
Wow.
What do you think we need? What do you think we need environmental health scientists?
Thank you very much. First and foremost, I would like to say that in one way or another, everyone out there should know that they are an environmental health scientist. Yeah, because if we are looking at things to do with proper disposal of waste, I know we all want to have clean environments and stuff. So by you carrying garbage and taking it to where it's supposed to be, you're literally promoting environmental health. So maybe you're not a scientist, like you've not taken in the desire to go and
they've not taken the initiative of studying it at that level you are at.
Yeah, but you're doing something to promote health and protect the environment. So back to your question, as a woman who is proudly speaking about environmental health science, I want us to look at mental health. Statistics showed that Uganda last year, the Ministry of Health showed that let's use an estimation, 14 million Ugandans are suffering from mental health. And mental health, we are looking at depression, anxiety, And all these things are coming out from the stresses of life, like the things we go through, the challenges. Then people end up being depressed. But then we are having people in this sector who are taking up the issue of understanding people's mental health, promoting mental health. Because when we are defining the word health, health is defined by WHO. Health is the state of complete physical, mental, and social well-being of a person, not merely the absence of disease. So in this, we are looking at mental health. So as environmental health scientists, some of us are really passionate about understanding people's mental health. We are seeing people are in families. Women are being beaten up. Children are being tortured by parents.
Even men.
Yes,
even
okay.
men are
you
being
talked about
beaten.
the line of women.
Yeah, okay.
So we are empowering women.
Yes, but women are suffering in marriages. People are suffering in homes. Children are being bullied at school. But right now we are having people who are passionate about people's mental health. We're providing counseling
Yes.
to people,
Yeah.
guidance, and various other things. Then still we are talking about, we have malnutrition. And we have things to do with...
Is malnutrition part of environmental health?
yes, we study about it.
No, what I mean, when you go out there in the field, is malnutrition some of the things you look at and maybe find solutions to?
Yes.
Wow. Today, we are delighted to have a team from Makerere University Environmental Health Scientists Students Association. We are discussing environmental health. Now, you who is just joining in with us is the president of the association, who is Shafik Senkubuge, and Doreen, who is a passionate member. You know, when I talk about passionate, I remember the passion she uses while talking about environmental health. So, Doreen,
Yes.
I think before we get to Mwesa, just in a minute or two, to finalize the aspect you had introduced before the break.
I was talking about malnutrition.
Yes.
We see women are giving birth. Let me talk about malnutrition under children. Some women don't want to breastfeed their children, but as environmental health scientists, researches have been made. Why are these children suffering from malnutrition? Besides these things of hunger, we are having women who don't understand the value of breastfeeding, and this is where environmental health scientists come in to educate the environment. Through one of the things that environmental health scientists do is carry out health promotions and education. Because if you want someone to carry on a healthy behavior, you need to communicate to them to change their mindset. So that is one thing we are doing as environmental health scientists, communicate to the general public the importance of breastfeeding children. Yes. One other thing that you would like to know, as women, you're not giving birth all the time, like 1 year after the year that you're giving birth. It's not good. So we talk to these women about family planning. That is all under health.
Okay.
Yeah, what environmental health scientists are doing.
Yeah, maybe Mokalas, if I'm to chip in.
Yes.
When you look at malnutrition, did you know that malnutrition is of two forms? We have got undernutrition when someone is malnourished, and overnutrition where someone feeds excessively. And really, currently the country is facing a number of challenges attributed to overnutrition, where someone
is it that we eat a lot? All.
Yeah, actually, right now the country, due to the repercussions of the demographics, increase in population, really people no longer focus on the food prepared. They usually take junk food, they take excess even of what is required. So really these have resulted into a number of chronic diseases, the likes of strokes, diabetes, the likes of chronic disease, hypertension, and all those diseases that are on rise, and those actually are attributed to be diseases of effluent. For us, we are known for being affected by infectious diseases. So really, it's malnutrition is key, and it is a key component that we really look at when we go out there in communities to health educate. Okay. Yeah. So, Kalas, I hand over to you.
Now we want to, because she talked about something important, that you cannot help someone transform their mindset, change their perspective over a certain habit if you don't go to them to tell them how bad it is and maybe show them what could result in from what they do. Now, here we are with Mwesa. I know before COVID-19 chipped in and the lockdown and all those things, you used to have a lot of health promotions, a lot of programs out in the field. Like he was talking about Molago, he was Kagugube, Nansana, and all those other places, plus those that are yet to benefit. So we now get to Mwesa. What is Mwesa, Shafik?
Yes,
as
actually,
the president.
Wow, thank you very much, Mr. Mukalazi Doreen. I'm very delighted to be speaking and informing people about the great platform Mwesa. Yes, when you talk about Mwesa, it's an abbreviation that stands for Makerere University Environmental Health Students Association. This is a body of environmental health students offering a bachelor's degree in environmental health at School of Public Health and in Makerere University at large. This association was formed way back, you can't believe, in 2003. Those our predecessors came up with an idea that really environmental health scientists have a number of interests here and there, and they would like to engage with communities, promote health, promote research, and reach out to different stakeholders who are passionate about environmental health. So they realized that we could form a body of students, have a leadership, and these students will really embrace prevention and reach out to the different stakeholders. So there were a number of objectives that they had on board that time round. They wanted to promote health of vulnerable people, the likes of under fives, the likes of pregnant women, the youths. You know that youths are really vulnerable people within our countries, the likes of the disabled. They had a will that really you can. And actually, even right now, we can promote research. When you look at activities that we do in regards to organizations of conferences, we want to present some of the research that students are doing and alumni are doing in regards to environmental health. So really, our predecessors had this in mind, and also us as the leaders that come in, we try to promote this in the different seminars we go to, the different workshops, the different conferences, really try to highlight some of the problems and some of the researches that has been done in regards to promotion of environmental health. So that's the key highlight. When you talk about environmental health, we might really spend an entire day here. So let me just end with that and then over to you. Thank you, Mr. Adrian.
Okay, so Doreen,
Yes.
he talked about the likes of Kagugube. I don't know why you chose Kagugube.
Because it's from Nansa.
Oh, yeah, I now know.
Yes.
Where are you from?
Me, I come from Namutumba district.
No, I mean, okay, Namutumba. Have you organized any outreach in Namutumba?
I am about to.
You are about to. Okay, as he goes to Nansana,
Yes.
Kagugube, Molago, because of course you're next to Molago, so those are the immediate beneficiaries.
Yes.
And then Namutumba, where you're about to go.
Yes.
What do you do when you go out there?
Yes, thank you very much for that question. One of the things we do when we go out there is promote environmental health. Some of the things that we are taught at school are what we carry out. Sensitizing the community in different areas. It can be about proper handling of waste, sensitizing them about certain diseases, how to prevent them, how to handle cases. For instance, let me use the example of COVID-19. When COVID-19 came up, there was a task force, and there needed to be people to be recruited and educated so that they can go out and sensitize the general public about COVID-19, because it was a new disease. We didn't know about COVID-19. So some of the people who were recruited were students themselves. They were educated, taught, and so they could go out and sensitize the general public about COVID-19. Some of the other things that are done in community are collecting health requirements that are needed by these communities. So we lobby for funds, advocate for funds, so that we can reach out to these communities that are vulnerable. Like he talked about the youths, the elders, the under 5. And then one other interesting thing is going out in the community, talking to the people, finding out their views. And this is done mostly in helping researchers because research is one of the things that we do as environmental health scientists. So you reach out into the community to carry out your research.
Okay. So what does it take if I want you to invite you, if I want you to go off Nansana and come to my community? What does it take?
Okay, thank you very much, Adrian.
Oh,
Actually,
how do you identify the spots, the places where to go?
Wow, thank you. So really, we are not limited to Nasana. Nasana being the home place that I come from.
But one of the beneficiaries.
That's one other thing that I forgot to say.
Yes.
Is organizing health camps together with the entire College of Health Sciences.
Okay.
Currently, I believe there is one health camp being organized to Mbale, right? Yes, so that is something else that we are doing. So it's not literally Nansana.
No, Nansana is one of the beneficiaries.
Yeah, so
the major beneficiaries.
So
Yeah, it is important by the way for you.
Okay.
For real. So if I'm to highlight some of the places we have been to during the course of our leadership,
Yes.
I will say we were in Mbali School of Hygiene, actually under the platform of you know that we have Environmental Health Workers Association of Uganda,
Yes,
abbreviated as EWAU. Really, those people have been there for us. They have mentored us, and they're really continuing to mentor us. We have been in Jinja for the World Environmental Health Day celebrations that are usually celebrated every 26th of September every year. This year we are there. We cleaned Jinja City, and we advocated for solving of environmental health related challenges in these communities. We were there for even the last time we were there on 1st December for educating about AIDS in the youths. We partnered with a number of other organizations and other youths within the community, and we tried to advocate for this. Then we were in Kagugube. Kagugube is just near here.
Yes.
Just a question, how do we
Gisenyi.
identify really these areas that we go into for these health education and then health promotion activities? We really usually have transit walks. I personally usually really enjoy walking around the streets. So the likes of Mulago, we realize that really Mulago has a number, the surrounding of Mulago National Referral Hospital, those communities have a number of challenges regarding to street and waste management, solid waste management, and a number of other challenges. So really, after identifying these challenges, we go down to request for the local leaders, the OC1s of these particular areas. We reach out to them, we tell them, we want to work with you. Then we work with KCCA. We try to partner with KCCA and see how possibly they can help us, because we are students and our workforce might not be that much. So after engaging the community leaders obviously they will engage their subordinates, the people they are serving. And when they engage them, even us, we really try to use that platform to pass on information related to HIV/AIDS. We provide condoms. We engage the communities and tell them really this is what you should do in regards to transforming your communities. And we really want that because it acts as a platform. We learn before even we leave school. It acts as a platform. By the time we leave school, we are competent officials. We have some working experience. By the time we are deployed to the different local governments, you know that environmental health really are employed everywhere as health assistants, health inspectors, principal health officers. So really use these platforms to boost our understanding and knowledge. That's why I really, which I embrace usually these platforms, and I really encourage other stakeholders to really join us and push these efforts so that students can really reach out to different communities. Thank you, Mukalas. I will stop on that. Yeah.
Doreen, as you give us your parting shots, what are some of the things you're proud of the time you've been you've gone to the communities? So you're using less than a minute to answer that, and then you give us your parting shots as we get to the close of this program.
Thank you very much for hosting us, by the way. Yeah, it's a pleasure. One of the most interesting things that I have when I went to the community, maybe it may not be a direct answer to that, but me going out to the community to understand that one of the challenges as to why Ugandans are not adopting to health behavior is because we are having a very we are poor. Most people are faced with poverty. That is something that was touching to me, And I really believe that as an environmental health scientist, I'm going to work so hard to find the ways of how we fight poverty in community to promote health behavior.
Wow. So touching.
Shafik.
Yes.
Your parting shots, your last remarks as we get to the close of this program.
Yes, actually, I'll try to take this opportunity to thank the Makerere University School of Public Health and Family TV Partnership for hosting us for this platform. If it wasn't that program, we wouldn't have been here, we wouldn't have been at the health port that is really beloved by so many Ugandans. And we are very delighted to be here, and we believe in the next coming programs you will see us, students will come and showcase to you really what they can do. You know that Ugandan students, even them that have reached at a level where they can present to our communities and communities can learn. So wait to hear from students, it can be your brothers, your sisters from the faculty of Makerere University. Thank you very much, Mr. Adrian.
We are grateful, and I think we can't go beyond this. Thank you so much, you who has been watching us. You started with us up to now. You're still watching HealthPort. Adrian Austin Mukalazi is my name. We meet again next time. Goodbye.